Hey guys, my name is Austin James Wolff. I'm here with Duncan Ross. He is the CEO and founder of KIMERA Labs. And I've also got my boss Stephanie here. She's also the CEO of Novus. So yeah, today we brought Duncan Ross in here all the way from Florida?
Miami, Florida.
Miami, Florida. Awesome. Sweet. And again, he's the CEO and founder of KIMERA Labs. So today we're here to talk about exosomes. Cool. So now that I've introduced Novus, I guess my first question is, who are you?
Well, as you said, my name is Duncan. I founded KIMERA 7 years ago. I have a PhD in biochemistry and immunology from the University of Miami. And I was interested in regenerative medicine because my background is in bone marrow transplantation, which is the first regenerative medicine, right? In 1957. And we knew a lot of things about how to regenerate your immune system, and so those things actually all became applicable to your joints. Same proteins, same methods of work. So when I saw this burgeoning industry of regenerative medicine, I got into it thinking that I was going to help Stephanie with her stromal vascular fraction transplants or bone marrow transplants. That I would quantify how many cells are in there, and I would keep the data and really figure out the right way to work this. Mm-hmm. And I did that for a few years, and it was functional, but it was about 40 to 60% functional. Then I decided I was going to start expanding the patient's cells so I could give them more cells. And that was more functional. 60 to 80% of the time we'd get some good reactions. But the relapse rate was what was really starting to bother me in these older patients. So then when I was growing some cells in the laboratory, I was growing old women's cells and the young women's cells. And the young women's cells were growing just fine, but the old women's cells wouldn't grow. So I thought, well, I know that there's growth factors and paracrine effect in the supernatant of the young woman's cells. So let me take that liquid from the young woman's cells, not the cells, just the liquid, and put it on the older cells and see what happens. And when I did that, the older cells started growing. So that was my Eureka moment in 2000.
So with the younger cells, you put the liquid from the younger cells just
on the older cells, didn't do anything, and the cells started growing. So this was in 2014, in March of 2014.
Yeah.
So I thought, oh my Lord, I've been throwing out this really expensive food that I use for these cells, which costs 10 times more than regular food that has animal products in it. This has no animal or human products in it, but it's also really expensive.
Yeah.
So I immediately started saving that liquid, and this burn happened to my friend. I was actually at his Halloween party, and he burned his face because he threw water on a gasoline fire. Party was over, and the next morning he's crying because he thinks he's going to be scarred for the rest of his life. And I said, I've got this stuff in the freezer. Let me use it on your face. And so they weren't sure because they knew I was a scientist, but this sounds a little weird.
Yeah.
So they asked around. They asked the plastic surgeon that they knew, and that plastic surgeon was going to put PRP on his face. And I was like, no, you can't do that because PRP is inflammatory, and you are going to definitely cause a scar. Mm-hmm. So I had to give her some literature, and she agreed with me and allowed me to treat him for 7 days, and it was gone in 7 days after applying.
You put this liquid.
Sprayed it on his face, and then he put Neosporin on top of that.
Oh my God!
And I had him redo that 3 times a day for 7 days, and then we got that outcome. And if you look at his skin now, or at 60 days later, it looks like he got a free facial peel, basically.
Yeah.
And so what happens was, and why you scar is you scar because you're inflamed. And the keratinocytes, so fibroblasts grow out really quickly. They cover the injury. But then if it stays inflamed, the keratinocytes cannot remodel the skin so that it looks normal. Babies can. If you cut a baby in the fetus, it will heal back perfectly. And why? Because they have growth factors and they're very anti-inflammatory. Everything's working.
Right.
So based on what I saw there, I decided to go to the youngest cell that I could ethically get, which is from a placenta.
Right.
So I take a C-section placenta, one. I've had one placenta in the last 3 years.
Yeah.
That's what's different. So I take this one placenta, I test it for everything you can think of, Epstein-Barr virus, Zika, things that I don't have to test according to the government. Of course, HIV and all those types of things. And then I grow the cells out of that. And so I could use one placenta for 10 years. I grow the cells, and if the cells are the olives, I collect the olive oil. So it's
that liquid you were talking about.
It's that liquid. It's a stem cell extract, basically.
Okay. Right.
And then I filter it, sterile filter it, test it, and then I release it after it's tested. So basically you have stem cell juice in a bottle that is purified.
Wow. Purified stem cell juice in a bottle.
Stem cell juice. And so
I have a question real quick, because I had a patient ask me this just yesterday. If you're only using one placenta, or you've only used one placenta for the past 3 years, how are you able to get that many cells from it?
Right, so we haven't seen the placenta in years, right? Placenta's gone. It's not like we have this piece of tissue in the refrigerator.
Right.
There are billions and billions of cells in that placenta. So you get the cells out of the placenta, you grow them a little bit, and when they grow, every time they expand, there's 2 of them. So by the time you get to 2 passages, you end up with lots and lots of cells that you can then freeze down and have a working bank.
Okay.
And it's that working bank that is so important, because that's how you get FDA approval. You have to have something that is repeatable, something that's not going to change every time it comes through the door.
Okay.
So when you have multiple donor tissue products, you have this issue that it could have Ebola in it. We don't test for Ebola, but it could.
Yeah.
So in this fashion, and we've treated probably 25,000 people by now, nobody's gotten Ebola, so we're pretty sure it doesn't have Ebola.
Right.
But it's easy when you go to a company like Eureka. They have a list of tests that they can do, and I just order them all. So every viral test that they have. Mm-hmm.
Okay.
So you have these cells, and the way that the bank grows is these cells basically multiply.
That's correct.
They clone themselves.
Right.
In biology class, what's the name for that?
Expansion.
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 Okay, got it. Cool. So you have these cells; they're constantly
Expanding,
cloning themselves, and that's how you know that this process is going to be the same every time, because it's literally the same cells just cloning.
It's the same deal. You could also call it passaging, but that's how we confirm that from lot to lot we're going to have the same product, because it came from the same cells, it came from the same donor.
Right. Okay.
Because every donor is going to have a different efficacy.
Right.
But our dosage is based on this one donor, and we know what that is because we've treated so many people. So, we know that in a person of X weight, we use this many vials. In this weight, we need to use more vials. So the larger the person, the more vials you have to use. But you wouldn't want to use too much, because it's a powerful product.
Awesome. Cool. Sweet. Okay, so this juice, do you have any questions?
No, so that answered that question.
Okay. So the stem cell juice in a bottle, is that what exosomes are?
No, and that's a fantastic question.
Mm-hmm.
So we have to go an extra step.
Okay.
And it costs me a lot to do that. I lose 90% of the exosomes by having to purify them.
Okay.
So if you know milk,
Mm-hmm.
milk has exosomes in it. In fact, we're drinking cow exosomes all the time, and those cow exosomes are hanging out in our body for 30 days afterwards.
Wow.
And making proteins. But you can't sell milk as exosomes. You have to get rid of the casein and everything else that's in that milk.
Right.
So by doing that, I end up with a very highly purified product, which I was just told by microscope manufacturers the purest in the world.
Yeah.
But I lose 90%.
Right.
So it's
all that other stuff.
All the
that's
other
in
stuff. So it's very expensive,
Mm-hmm.
to do that. It's expensive as far as the cost of exosomes.
Okay. Gotcha. And for our audience that has no idea about exosomes, they just stumbled onto this video for no reason.
Right.
What are exosomes?
Thank you.
So exosomes are little bodies that bud off of cells. And the best way that I like to think about it is like a football. So you got a quarterback, and he's got the football, and he wants to get it to a guy downstream. Well, he doesn't run and take it to him. He throws it to him. Mm-hmm. And that's really how the body communicates. Oh. So imagine that inside that football are the messages. Like if you could open in football easily and it had a message from Paul Revere or something like that. It would have been easier just to throw the football and then open it and grab the message out of it. And so that's how the body communicates. It does not send a protein from your hypothalamus down to wherever it needs to go. It sends a courier. It sends that football.
Right.
And it takes the message down to where it needs to go. And then it prints the message where it needs to go.
Okay.
It doesn't print it up here. It prints it down there.
Right.
And that's how it really works, because proteins are very labile properties. They denature very rapidly. Mm-hmm. So they're not hardy enough to get around the body. But a lipid vesicle, a ball that's protecting it, help it get around the body. And even more importantly, it protects the messenger RNA, which is the blueprint for the protein.
Right.
And that's how it ultimately works.
And what sort of messages are being carried?
Well, anti-inflammatory messages, growth messages, longevity messages. Mm-hmm. Whatever a baby does, that's the best part of it. It's like, I haven't thought through this completely yet. You know? And they keep surprising me. Literally every couple months I get a surprise out of them. Because, babies do so many things. They don't get cancer. They're anti-inflammatory. They're growing. They're happy.
Yeah.
And all of these things are encapsulated in that exosome. So, you can use it for depression. That's actually one of the first thing we're taking through the FDA is depression.
Wow.
Yeah.
Using focused ultrasound.
Wow.
Which targets it to the area.
How does it do that?
Yeah.
Well, that's very interesting. So this was developed by Dr. Sheldon Jordan from UCLA. There's a $20,000 high-frequency focused ultrasound machine that is FDA approved for breaking down strokes. And the way it does that is you target it. So you have to do a functional MRI of the brain. You find where the stroke is, and then you target the energy right at that thing, and it shakes it and it breaks it up. Well, depression is caused in the frontal lobe, so you can target the frontal lobe, cause a little bit of shaking there, and when you give the exosomes intravenously, it traffics to that area. Now, this is it's not FDA approved right now, what I just told you.
Right.
We are getting it FDA approved, so it's not something that can be done by everybody in every office right this second.
So that's another question, obviously, that patients are asking is, does this cross the blood-brain barrier, right? The exosomes versus stem cells.
So stem cells do not.
Right.
Exosomes do.
Because they're tiny microvessels.
You know, cells do cross the blood-brain barrier, but they do it in very specific places.
Right.
So in your circulation, you have 10,000 lymphocytes per microliter, and in your central nervous system, you only have 4. But how did they get there? They cross over in this lymph node that's right here in your chest. There's a special place where there's a bridge, sort of. But they just randomly don't cross the blood-brain barrier.
Okay. So as far as P shots, because we do quite a few P shots here in the clinic, you know, we see about 80% men here, and they're coming in for either sexual performance, erectile dysfunction, Peyronies. We even have infertility cases, guys who are trying to boost testosterone, and so kind of give me an idea about.
Those are all fantastic questions, and we have touched all of them.
Yeah.
We're finding that testosterone levels go back to normal when used just as an anti-aging property. We also have one very interesting thing that this crosses over from. I told you I used to grow cells for people.
Right.
I've always known when I dialed in the correct dose, the men started reporting erections in the morning. That's kind of how I knew I got there. And even when someone would say, I got no benefit out of that, I'd say, no benefit at all? He says, well, maybe one thing. What's that? Right? So that's how we know. And I actually just had a really famous actor the other day tell me, Sam, I'm having some erection episodes. And, he says, and I put them to good use. So I had one of the, a very important urologist in Las Vegas make me go out to dinner with him just so he could thank me, because since they switched the P shot from amnio to exosomes with, they went from an 80% efficacy to a 95% efficacy. Wow. And he has
That's
150
incredible.
urologists underneath him. So it's amazing what they can do. When you talk about Peyronies disease, what was Peyronies disease caused by? It was caused by inflammation. I mean, we can stop that inflammation.
Right.
So the growth factors and the anti-inflammatory factors are really fantastic. They're in them.
So, okay, let's talk about Peyronies. And what happens is these men come in here and they're upset because they've spoke to urologists, and urologists say all there is for treatment is Xiaflex or penile surgery. So we're kind of like their last resort, and we're explaining to them that these exosome P shots can help their Peyronies. The question becomes, okay, that's great. What is your success rate, and will my Peyronies come back, and how much time? What's that length of time?
Okay, so it's very interesting regenerative medicine. Even the Mayo Clinic at the Toby conference put up a video of a patient, and she said, you know, they treated my back and I thought that they had stolen from me, but 8 months later my pain went away. And that's really key to understand. It took 9 months for us to be born. Why do you expect something to be fixed in a week? So the way these exosomes work is they persist in the body for up to a month. Not all of it persists, but some of it persists. Some of it persists for a week period of time. But what it's doing is it's changing the milieu in the body, which will ultimately become a permanent change. So there's one protein in the exosomes called TGF-beta3, and that's something that comes from bone marrow transplantation that we know so much about it. There are thousands of papers written about this. If you take a dish and you cause inflammation in that dish and you put that one protein in the dish, the inflammation stops. So the inflammatory CD4 T cell turns into a regulatory, non-inflammatory T cell, and it stops everything else around it.
Okay.
So unless some other inflammatory insult comes up, that T cell that was causing inflammation is going to stay off.
Right.
Right. So you're going to see an immediate recovery from exosomes. That comes from the proteins. But then you're going to see a more drawn out 6 week to 3 to 4 months to even 8 months, like I just said, to get that secondary wave of regeneration.
Okay.
So
it's really kind of changing the way that the cells respond.
Function. It's making them act like younger,
right,
happier, less inflammatory cells.
Okay. Makes sense.
Mm-hmm.
Cool.
Back to how long is this going to last? So, you know, will this come back? Will my Peyronies come back?
I don't believe that anything is a one-shot deal in regenerative medicine. I believe it's a 2-shot deal. So these treatments should be spread out by 3 months, and after that you should not see too much trouble.
Okay.
Mm-hmm.
Awesome. What about side effects?
Side effects, that's a good question. So The way I say it is, this is a Viagra, okay? There are other people that make Cialis, but this is Viagra. Does anybody want a Viagra that's 10 times stronger than a Viagra? I don't know a man that wants that, okay? So you use this thing once, and it is anti-inflammatory. So if you're using it in an area where you had herpetic lesions before, you have a T cell that's holding that herpes down. Anytime it sees it on the cell surface, it kills the cell. You are going to slow that cell down, and that's what we're trying to do. So sometimes you can get a herpetic lesion come out. Other than that, we have not seen any side effects.
Wow.
So it could make something worse before it gets better, just like
If you have a viral infection,
okay.
which you should probably, the patient should tell you
Okay.
ahead of time. There's nothing wrong with that. We can work ways around it. We can give them Valtrex, for instance.
Acyclovir.
But
yeah.
if you don't tell us, then we can't do that.
Right. Okay.
But if you do give them acyclovir, then you're good to go.
What about, long-term use? So patients will say, okay, this is great, this is new medicine, regenerative, I get it, but, long-term, what's going to happen? What's going to happen to my body in 5-10 years? Because nobody's really studied it, so they don't really know.
Yeah, I think it's funny when people say it has a shelf life of 5 years when it hasn't even been out for 2 months. You don't know that, do you? But I did something at the beginning, which, might sound stupid now, but I was trying to figure this out. I gave myself 50 times the dose that we're currently doing.
Wow.
Right, and I gave a nurse 50 times the dose at the same time with me. And but I didn't have anything wrong with me, right? So the next days, I didn't really feel anything. I was like, oh, well, I guess it's safe. I know that. But she started telling me that her back pain went away, and then she told me something really important for what you've been talking about. She said she had the strongest menses she's had since she's 20.
Wow.
And I have since that point gotten 3 people pregnant. Not me personally, but there are little babies that were caused by that. So, but what happened to me was 8 months later, my wrinkles went away.
Oh my God.
And I was not out using cream or anything. And I had these really strong, and I have some wrinkles right now because I'm not going to give myself 50 times the dose. I can't afford it. But these wrinkles here just completely went away without cream.
Wow.
And fortunately, they came back because remember, we're not trying to rewind our aging too much.
Right.
We're just trying to maintain.
Right. And we're always aging. That's the thing.
Right.
It's like we're not stopping the time. We're just trying to rewind you a little bit, but you're still going to progress.
Exactly.
Right?
Well, we want to treat it like a wave. And,
Okay.
and in reality, literature already has come out that we do know how to rewind aging. You take 2 steps back, 1 step forward. It's the opposite of the song. But that's how you do it.
Okay.
So what we're doing right now is just trying to maintain what we've got.
I love it. What about, let's think about...
I saw a video at the 8th REM conference. Someone was giving an exosome panel speech, and they showed this video of this person who was paralyzed. He gave him exosomes, and then they showed him later moving his legs and then doing leg presses.
That happens, and that's under the purview of the physician.
Mm-hmm.
That he is able to practice medicine, and really that's the way the FDA treats you. Is nobody at the FDA knows how to practice medicine as well as a doctor knows how to practice medicine.
Of course,
you can't really argue with them. You can regulate the tools that they use, but if they want to try to approach a question like that, they can do so. So you'd have to ask a doctor more about that.
Gotcha. Cool.
A physician as opposed to a scientist.
Right. What sort of false beliefs do people have about stem cells?
A lot of false beliefs. So when you get stem cells in a vial, as they come in a cryopreservant, so that an antifreeze basically. As soon as you warm it up in your hand, those cells die because it's lethal. Right. When I do that in the laboratory, I have to get them out of that as rapidly while they're chilled.
Right.
So the problem with stem cells is why would I not still be involved in stem cells? When I realized that I could do without stem cells, I was ecstatic, okay? Because cells can cause an inflammatory result. Yeah, a lot of times they work and stop an inflammatory result, but they can also cause an inflammatory result. They do have DNA in them. Bad things happen when you have DNA. Exosomes do not have DNA in them. Mm-hmm. And you can have an allergic reaction to just the antifreeze that's in the tube, nothing to do with the cells. So those 3 things alone, there's a 4th one, which was a real scare. Cells are the same size as bacteria. If my cultures get contaminated, I can't get it out. It's ruined. I have to throw it out.
Yeah.
Exosomes are sterile filtered because they're so much smaller than bacteria. So the opportunity for contamination is very large when using cells, and that's why the FDA has been coming down so hard on it. They just don't want to hurt people.
Yeah.
I mean, exosomes could work or not work, they don't care, but they know it's not going to infect anybody.
Right.
And that's kind of the environment we're playing in.
Okay.
Okay, so quick question then. You were talking about the way that the stem cells are sent to us in the cryo tank. The exosomes.
They don't need that because there's no cells.
Right.
And there's no cryopreservant.
Right.
It's just saline with these little exosomes floating around in it. So it can be kept in your regular freezer.
Perfect. And so when we do defrost it, we're not killing anything off.
No.
We're not harming it. We're not doing any damage.
Nope.
Okay.
Everything's there.
Everything's intact.
What sort of false beliefs do people have about exosomes?
The people who are still holding on desperately to the stem cell idea, because that's their business,
Right, yeah.
they like to say that exosomes aren't smart. You know, the problem is when you put a stem cell in a body, if I put my stem cell into you, it's gone in 12 hours, 12 to 14 hours, and it might cause inflammation in that time. So this idea that the cell is going to home to where it needs to go and then release anti-inflammatory factors, it might never make it there.
Yeah.
Then they say, well, exosomes are dumb. They don't know where to go. So, but they do know where to go because your endogenous cells, the cells are already in your body, take them where they need to go. So they end up in the liver and the spleen within 9 hours. And then the macrophages in the spleen, then they can go out to areas of inflammation in the body and suppress them. And that's even when you put it topically. I mean, I've seen papers that you cause a little wound right here, and that exosome will end up in the lymph nodes in about 3 hours.
Wow.
And you can see it there.
Wow.
Yeah.
That's incredible.
That's awesome. You have any questions?
You know, I wanted to ask a question about the hair. I know that you're kind of following.
That's okay. Ask away.
So I read something about, injecting exosomes for the hair restoration and how it can help turn gray hair back to regular colored pigmented hair.
Did you hear me say that?
No.
Oh, okay.
think
Because
I
I read that
it.
paper.
Yeah.
Yeah. So there is a protein called stem cell factor that was noted in that paper, turning it back. And when I did the growth factor panel on our exosomes, there was stem cell factor. It wasn't in amniotic fluid, but it was in the exosomes. Remember, these are placental mesenchymal stem cell exosomes.
Right.
But it does have stem cell factor in it.
Okay.
I have not had the chance to prove that paper or reproduce that paper, but I do know I have the protein that you need
To do that. Okay. So maybe that's something that we try.
Yeah.
Yeah, and on that note, exosomes, can they be combined with other things like
Exosomes should be combined.
Okay.
And actually Arnold Kaplan, who named the cell the mesenchymal stem cell and then changed it to mesenchymal stromal cell, he nicely enough said, you got to remember this is not a one-shot deal. These are tools. And in fact, let's say you wanted to work on a knee. You shouldn't just throw the whole kitchen sink at it right there. You should prepare the soil a few days earlier, maybe with amniotic fluid.
Yeah.
Then put whatever cells or bone marrow. I mean, I do like bone marrow. It's anybody's bone marrow. Put that in there on the day you're trying to use it, and then create a protocol going forward where you use different growth factor products to sort of stimulate those cells. I mean, so that's the way to think. It's not one and done.
Okay.
And in fact, that might even be 3 to 6 months. I mean, I had a patient in Ecuador who's really the best one that I ever did in Ecuador, and I did it just that way, and I did it twice. And he just hasn't had no pain. He was a professional soccer player.
Yeah, what was his story? Did he like?
He had been playing soccer his entire life. His legs were like this big,
Yeah.
And he just ground down the cartilage. And so by treating him with exosomes, his own cells, we were able to really heal him.
Gotcha.
Mm-hmm.
Gotcha. Okay. As far as using exosomes versus using stem cells, of course, we already talked about the quote dangers of possibly using stem cells. Do stem cells still secrete these exosomes, right?
They do, as long as they're alive.
Right.
And if they are alive.
Right.
I actually think what's happening, why cord blood, I don't like to say that nothing works. I mean, PRP works, or why wouldn't it be here, right? Cord blood must have worked to an extent. I think it was probably the exosomes that were in the blood already
doing the
that
work.
were working instead of the actual cells.
Gotcha. Okay.
Because you see, cord blood is very highly enriched in regulatory T cells. There's no mesenchymal stem cells in cord blood at all.
Right.
But there are regulatory T cells. And regulatory T cells secrete anti-inflammatory exosomes. So that's why you would get that result.
Gotcha. I'm sure there's a lot of, I don't know if you've seen this, contradictory information on exosomes.
Sure.
Some people saying things that other people say no. I was listening to a podcast. Great way to get information, right?
What there is there's tissue bank education,
Okay.
which are people that aren't scientists,
Okay.
versus pharmaceutical education, which are scientists.
Okay.
And they're entirely different. But if you really want to know the truth, you go to the pharmaceutical companies that are making exosomes, and they're out there.
Really?
And you've never heard of them.
Yeah.
Yeah.
I haven't.
You have not. So all the names that you've heard of, you take what they say with a grain of salt.
Okay, gotcha. Well, this particular person was saying that, I just want to get your take on this. They were saying that some exosomes already have instructions, like one has instructions for anti-inflammation and one has instructions for regeneration. Is that bogus?
No, that's not bogus. We try to use the word tuning lately.
Tuning.
And ultimately, KIMERA will have 9 different tuned exosomes.
Oh.
But what's really the bottom line? The bottom line are the growth factors that are in the exosome. I don't care whether you tuned it or not.
Mm-hmm.
And we have an exosome right now that I have already shown via protein and messenger RNA sequencing has anti-inflammatory and growth-inducing proteins in it. Why would I want to mess with that?
Mm-hmm.
It's really the saying, if it ain't broke, don't fix it.
Right.
We have a product that works, that can be FDA approved. If I tune it, what if I lose the anti-inflammatory milieu?
Right.
What if I make it more anti-inflammatory and I lose the growth factor milieu,
Right.
which is probably what's going to happen.
Right.
So you don't start making those tuned exosomes until you've exhausted all the uses of the current exosome. And let's say TGF-beta-3, for instance. I tune it to be a more anti-inflammatory. I get 3 times the amount of TGF-beta-3. That's great, but I could have just used 3 of these bottles and gotten the same result.
Right.
Right.
Right. Without messing with
Without messing with the other.
That makes
growth
sense. Okay, cool. As far as applications for exosomes, we do a few things here at Novus. Sexual function, hair, a little bit of aesthetic, and
Yeah.
also pain management. Well, what sort of things have you seen?
Aesthetics is really the golden goose here.
Really?
Right. That's why we
Okay.
call it Exoglow.
Right.
Is because of I said before, the 30 collagens that he now has in his skin versus the 8 he had as a 53-year-old.
Yeah.
When we use this, without much work, the pore size is just tiny after we're done.
Yeah.
And that's what women really want. They want baby-looking skin. I mean,
Right.
everybody does, right? So there's a machine called a Visia,
Mm-hmm.
and that Visia gives you your age as opposed to the rest of the population. And that machine told me I had an age of 48. I am 44. So, by using just the exosomes and what do you call it? Microderm. I got my age down to 41.
Oh.
Wow.
Right. That was with 2 treatments. And that's just the way it works. Regarding the vampire facelift, I like PRP. Like I said, PRP is a great way to get rid of wrinkles. It is not a great way to make your skin look younger. That's why there has to be a 2-2 punch.
And then that's a false belief that a lot of people have because it's marketed as
Right, vampire. You would think.
Yeah,
Do you know vampires go back thousands of years? The idea of the vampire came from Greece, not from
Really?
Count Vlad.
oh
yeah.
shit, wow.
So people have been drinking the young's blood for years. I don't think that they just sacrificed children on top of the Mayan temple and then just threw them out.
Yeah.
I think they were collecting the blood and drinking it.
Right.
Makes sense.
Yeah. So that's in effect what we're doing. What's in blood? Young exosomes. So we're taking that young exosome, and by applying it after the vampire facial,
Right.
you can rejuvenate the skin.
Correct. With all the tissue growth and collagen production.
Right. Okay.
Now,
Go ahead.
treatment-wise, though, right? So again, kind of going back to how long does all of this take?
Mm-hmm.
And tissue takes time to heal.
Tissue takes time. Well, in the case of the vampire facial, you'll see it 3 or 4 days later.
Wow, that's
Yeah.
incredible.
In fact, if you cause inflammation by, say, Ulthera fractora, I had Dr. Suzelle Vasquez tell me this in Miami. She was like, listen, Duncan, your product is 100% effective. I cause inflammation, and by the time they leave the clinic, the inflammation's gone.
Wow,
You can see the skin go white. It's crazy.
that's incredible.
Mhm.
Wow.
Okay.
That's incredible. Okay. I guess my next question is, what have you seen for exosomes as far as male sexual function goes?
Well, so the reason I like LA, and I think we're gonna have more of a presence here, is it's fun to treat the celebrities.
Oh yeah.
Right. So
Yeah.
And as I told you, men with erectile dysfunction, they actually past a certain age, they don't start waking up erect anymore.
Right.
And the change in that is what everyone notes.
Mhm.
In fact, I find it kind of annoying. So I've kind of decreased the amount that I use. But that's what we see. So that's why I started using this term Viagra. You know, it's as strong as a Viagra in many, you know, in some ways.
Yeah.
And that's as strong as a product that you want.
Right.
You know, so.
Okay, so speaking then now for females, right? I was reading about the exosomes can help with urinary incontinence, but obviously, you know, when we're selling the O shot, we're selling it more for enhanced orgasm, enhanced sexual pleasure. Of course, you're always going to get the urinary incontinence part of it, but that's not really, you know, what's happening. And then I was reading the article about exosomes. It's specifically used for urinary incontinence when injected into that specific spot. So, you know, same idea as what you're talking about with men when we're injecting for the P shot. You know, what is your...
I was kind of aghast the first time I saw the O shot. And apparently it works, but why are you causing all this inflammation in this poor girl? You know, it would seem that would be the opposite of what you would want to do.
Right.
I mean, you do want to increase vasculature, but you want growth and rejuvenation and regeneration, but you want to avoid inflammation, because that's really the root of all these evils. Inflammation against the nerve makes it lose its control.
Right.
You know, so by stopping that inflammation, you can end up with a more supple outcome, I guess you would say.
Okay, good.
I know that you were talking about how, you know, you used the metaphor of like, oh, exosomes, sort of like this Viagra. I was reading a paper, I might have misread it, but it was a paper on exosomes for hair, and they were saying how the effect it had was similar to the minoxidil control group. Like, is that
You
one?
read that? Well, we see, and when I say Viagra, I mean that Viagra is the strongest immediate drug that you have. This does not function like Viagra.
Right.
But what was your question again?
In this paper, they were talking about how they had a control.
Oh, right. Yeah. So with hair loss, there's two types of hair loss. Mm-hmm. And the most striking thing I've seen is in women, right? Because that's an autoimmune disease, alopecia areata. I've seen a woman's hair go from 5% hair to 85% hair in like 6 weeks.
Wow.
I mean, it's just, and I know the proteins that are doing this. It's just easy to understand.
Yeah.
With males, interestingly, we were afraid. We thought we couldn't grow hair out of in the middle of nowhere, basically, in the center. I thought we needed to sort of drag it in from the edges. Mm-hmm. But we're finding if you use a high enough dose, you can make hair grow out of the middle of nowhere. Yeah.
So you don't need to have actual hair follicle, or, you know...
Apparently not.
To do this, okay.
Mm-hmm.
And this isn't just as a disclaimer. This isn't proven yet, right? It's just
these things are all anecdotal, right?
Right, all anecdotal. Okay,
Mm-hmm.
got it. Okay.
Wow, that's incredible.
Right. The first thing that I'm really going to be able to give you with backed up science and published is craniofacial neuralgia with secondary outcomes of depression and renal function.
Okay, and that'll be the first.
And that'll be done at UCLA with
oh wow,
with very rigorous follow up.
Right. Gotcha. So most of the things around exosomes right now are mostly anecdotal as far as the results.
That's correct.
Like first-hand accounts,
the
second-hand
whole
accounts.
world, right?
Right.
The only thing that is proven is Duchenne muscular dystrophy.
Really?
Wow.
Okay.
Mm-hmm.
Gotcha. And even though we have photos like you know, this guy
seeing is believing, right?
Right.
I mean,
yeah.
I didn't. Although I was excited when I saw what happened in vitro, when I started to get cells to grow with the exosomes, just like everybody else, I didn't really let go of cells in treatment until I saw that.
Right.
Yeah.
Gotcha. Okay, that makes sense.
Wow.
What about exosomes to help with pain, joint pain, other sorts of pain? How do they help that? Like for example, your guy, your soccer player. I'm sure he had joint pain because of no cartilage left, right?
Yeah, I can't really answer that.
Okay.
Well, let's look at it this way. I can, actually. Okay. Ask me that question again.
Okay. How do exosomes help with pain?
Everything, all the products we're talking about, from Wharton's jelly to amniotic fluid to the specific Exoglow product, has exosomes in it.
Mm-hmm.
Exosomes, for instance, in amniotic fluid, suppress the inflammation, which allows the stem cells that are still there in the cartilage to grow out. And so by giving growth factors that are in those exosomes, and there's about 300 billion exosomes in 1 milliliter of amniotic fluid. They're entirely different than the 1 billion exosomes. And in fact, I have more TGF-beta 3 in 1 billion exosomes over here than in the amniotic fluid.
Right.
So you can't really compare numbers to numbers that way.
Okay.
But they are all effective when used at the right place. So amniotic fluid exosomes are really an important key to the treatment of joint pain, and can be combined with other types of exosomes.
Wow.
So
Okay.
really, when you think about it, I mean, all inflammation can cause some kind of disruption or pain, right? So if you're getting rid of the inflammation with the exosomes, then you're going to get rid of the pain. So if you just kind of think logically, that makes sense.
There was a great study done also by the Mayo Clinic that really blew my mind. So they had patients that had 8 or 9 out of 10 pain in both knees.
Okay.
And they took their bone marrow and put it in one knee, and both knees got better.
Yeah.
Wow.
You
Yeah,
know?
I was hearing about that.
Well, you've heard that, right?
Yeah.
Why is that? Because exosomes were leaving the joint, and bone marrow is very anti-inflammatory, because bone marrow has to protect hematopoietic stem cells. They
Right.
can't get inflamed or they'll differentiate and you'll die. So there's all kinds of anti-inflammatory products in bone marrow. So those can circulate around the body and suppress inflammation.
Okay, so then that goes to another question. I had a patient yesterday who he was getting a P shot, and he also has left hip pain. So he was wondering, well, because it's all in the same area and I'm treating...
He probably will see something. The one problem with bone marrow is not regenerative.
Right.
So it is anti-inflammatory, but it's not going to heal things.
Okay.
So if you want to get rid of some immediate pain, you could use bone marrow. If you really wanted to get rid of pain long term, you would use something else,
Okay.
something younger.
Okay.
Younger. It's all about young. When I count to 3, you're going to say young. 1, 2, 3.
Young. Okay, I got a question. I'm trying to think of more ways to explain this to like a 3rd grader, right? Because I mean that's basically how I think. So,
Right.
So one sort of metaphor I've been coming up with. You tell me if this is off the mark, on the mark. Exosomes in your body, you have the ability to regenerate. Exosomes turn on that mechanism. Is that how close or far from that?
Well, so let me give you the example of lactose tolerance.
Okay.
We're all supposed to be lactose intolerant.
Yeah.
You're only supposed to be tolerant for 3 years. It happens that some of us are longer than others, but what happens? You pass that gene down to your children, right? So there's no problem with the gene. There's a problem with the expression of the gene. So the exosomes from a young child have the ability to cause the re-expression of genes. And I have not shown that it will bring lactose tolerance back, but that's the idea for other types of growth factors. So what's happening is we're growing until 20 and then we have to stop so we don't become Andre the Giant.
Right.
But then we're just petering off to death. And how do you functionally make something peter off? You close the growth genes. So as more growth genes get closed, you slowly start to die.
Okay.
But you can open those genes back up because you still have them. There's nothing wrong with you.
Oh.
You know, those genes have been around for how many billions of years, right?
Right. So the exosomes turn those genes on, right?
Right.
Okay.
And
Got it.
that's why the recovery, the regenerative effect, can take months.
Right.
Because it's really up to your body and how far gone you are, actually.
Right. Could that similar metaphor be used for erectile dysfunction?
It could.
Okay, so these exosomes would go on basically into the penis and sort of
wake up these dying cells, basically.
Is that sort of
Yeah.
okay?
And it would wake up areas that are close to where you're treating.
Okay.
Got it. I'm assuming we could say the same sort of metaphor for hair as well.
Absolutely, right.
Okay, gotcha.
Waking up the hair follicle.
Waking up the hair follicle. Depending on what's going on. Remember that was
Yeah.
in men. In women, it's a stress and inflammation problem, and that's even easier.
Mm-hmm.
Yeah.
Right. And then for females with urinary incontinence.
We're calming down the nerves that are not functioning correctly.
Okay, gotcha.
But still building tissue too,
Right.
correct?
Yes.
Okay.
This is a question that we got. Can exosomes help someone recover faster from surgery?
Oh, yeah. So what we're doing now in the aesthetics world is creating a line. You know, the surgeon makes a line where he's going to cut, and then you apply the exosomes before even cutting.
Oh.
So you don't even give the inflammation a chance to start.
Oh my God.
Wow.
So and I came to me in the shower one day, and I
That's
asked
great thoughts too.
I asked Dr. Greg Chernoff to do that for me, and he did it, and it worked. And he sent me the pictures, and that's just fantastic.
Going back to surgery, your question about surgery. So if somebody comes in here and they say, oh, I'm getting ready to go through hip surgery, knee surgery, shoulder surgery, would it be best for them to at least start treatment before they actually go in?
I'd probably pre-treat them like right before they went
Yeah,
in.
okay.
And now that inflammation wouldn't start, so they wouldn't be in as much pain afterwards.
Right.
It's fantastic.
Okay.
Wow. What about
Now, however,
Mhm.
if they're being cut open, you should tell the doctor so that they prophylactically prescribe antibiotics, because we don't want to suppress their immune system and then they get sick.
Right.
I've decided that I'm not going to have regular reps. I'm just going to have all doctors, right? So I have 3 MDs and 1 MD PhD on my staff,
Okay.
right? And one of them is a pediatric surgeon, and it was the most. He aspirates bone marrow the most beautifully you've ever seen anybody does it. He's like an artist, right?
Mm-hmm.
But he would tell me how these kids are already recovering before he's even done sewing them up after when he did surgery.
that's
you know?
insane.
Right, and that's what we're doing here.
Yeah.
We're providing the same products that cause that.
What about the future of exosomes? Where do you see the future going? The future of the world going with exosomes?
Well, the future of exosomes is in having tuned exosomes that are specific for certain things, like chondrocyte specific, so that we can create cartilage.
Yeah.
Neural specific, so that we can increase, brain function. Exosomes are very important for diagnostics. I mean, we can take a drop of your blood and see if you have certain types of cancers, and that's what people are really working on right now.
Wow.
So because I need so much equipment, so many diagnostic equipment for the laboratory, I'm opening a diagnostics laboratory that's going to focus on those types of things.
Wow.
Oh my God.
So we heard that exosomes cause growth, but do they cause cancer?
Well, this was something I've been worried about since the beginning. If they're anti-inflammatory and they cause growth, what's going to happen? Fortunately, what's been happening the last couple of months is literature has been coming out that tells us that a baby exosome does whatever a baby exosome does, and babies don't get cancer.
Right.
So in many cases, a cancer, not all, a cancer is because you've lost the expression of a gene. And like say pancreatic cancer, it's usually P53. If you put the message for P53 back, even though the cell isn't making it, the cell will start acting normally.
Right.
And so people are taking myeloid tumors in a dish, putting an exosome in it, a baby exosome, and the myeloid tumor stops growing. So others are doing that same type of thing with liver exosomes and giving a tyrosine kinase inhibitor at the same time, and the tumor actually starts to retract. So they do not cause cancer, and in fact, when you have a certain type of cancer, they could resolve it. However, other types of cancers, they could make it worse. So it's important, such as one that is replicating rapidly and does have that machinery in place. If something, we don't want to grow vasculature in a tumor that's already there, and it's not as a cause of P53. So you would have to look at the genetics of the tumor before you treat.
Okay.
So you should not treat patients with cancer.
Mm-hmm.
Okay, that's what I was going to ask,
Right.
because that's on the contraindication
But
list.
it's not
even
going
though-
to cause cancer.
Okay, okay.
Mhm.
So here's another question. I had a patient come in and she says, well, how do you know if I have cancer, if I don't have cancer? And then I do this, and then it spreads the cancer. So she's saying, I feel healthy. I know I'm healthy. I've gone and done all the tests. But what if there's that small percentage that something's growing?
There's a small percentage that you're going to eat a peanut and die, because your immune system is one of those 0.01% that recognizes it and causes an issue. Right now, I think that there isn't a risk. I am creating this diagnostics company so that I can 100%, well, we'll never be 100%,
Right.
but I can try to assure you that you don't have anything going on. But certainly, if you're worried about it, you should see your oncologist and have yourself tested. But I mean, it's a good thing to do anyway.
Right.
Right.
Okay.
Will exosomes ever be a thing you can order online and use yourself in the far near future?
Well, when I started this, I thought I was going to make a cream.
Yeah.
And the cream worked on me, but the cream didn't work on my mother. And then the cream worked on my friend, but it didn't work on his mother. And I started to understand that you're losing stem cells as you get older. And you have to have an intervention by a physician to try to make things happen, cause inflammation to get the cells to the area, etc. It has to be guided. So, in some cases, maybe you could do it, but it's not even financially worth it.
Right.
Because if it doesn't work, it ruins whatever brand you're trying to create.
Right, of course. Yeah. Okay, I guess my next question is, where can someone, whether it's myself or someone watching, where can someone learn more about exosomes?
You can learn more at exosomes.com.
Oh, cool. Exosomes.com. Easy.
Try to remember that.
Any good books? about exosomes?
There are books about exosomes out now. I don't have any.
Yeah.
And reading the literature is kind of complicated.
Yeah.
But I'm sure you can just Google that. We have a book chapter that Doug Spiel wrote.
Mm-hmm.
I have a chapter that I was working on that never gets finished.
Mm-hmm.
But eventually, there's probably lots of places you can read about it now. Just be sure that you differentiate that every cell secretes exosomes. There's apples, there's oranges.
Mm-hmm.
There's even tumor exosomes, which is the first thing you're going to see if you Google exosomes.
Yeah.
Is tumor exosomes. But we're not talking about exosomes from a tumor here. We're talking about exosomes from a baby placenta mesenchymal stem cell, which doesn't have cancer. So it doesn't make cancer exosomes.
Right.
Bone marrow exosomes are going to be gotten from an older person. You can't take a bone marrow aspirate from a baby.
Yeah.
Well, if they're older, they're not going to have the growth factors, regenerative effect that we're looking for.
Right. That makes sense.
Every tissue has different exosomes. Even the MSCs from every tissue have different exosomes. Because the MSC is really the center of your body. You used to think of it as your heart, right?
Mm-hmm.
But when you're growing, one cell controls that growth, and that's the mesenchymal stem cell. Your kidney epithelial cell doesn't care what the liver cell is doing. It's not going to do anything. But one cell is making the whole organism grow.
Yeah.
And so that's why we've got this one youngest cell that induces growth, and we're using that.
So I actually was reading the paper. You gave me a journal, I think.
I think that was Spiel's, yeah.
Yeah, but it's not like a case study. It's almost just kind of gives you information behind exosomes.
Right.
And one of the topics was treating type 2 diabetes.
Well, Dr. Spiel, and this has been shown for a long time, mesenchymal stem cells suppress inflammation. The loss of pancreatic islet cells is because of that inflammation. So you can suppress diabetes with just mesenchymal stem cell exosome, with mesenchymal stem cells. So it follows that whatever you can do with mesenchymal stem cells, you can do with exosomes.
Okay.
Wow.
And that's what's being seen.
So it's actually repairing.
It's suppressing the cells that are killing off
Right.
your endogenous islet cells.
Okay.
And that had
There
been
you go.
done before with regulatory T cells, lots of different things. So that actually hasn't, I've seen it work so many times that it's not even a question to me.
Wow,
Yeah.
that's incredible.
Hey guys, thanks for watching. If you want to find out more about exosomes, you can go to exosomes.com, right?
That's right.
Awesome. All right. Well, thank you very much for coming
Okay, thank
on
you.
by Novus. Really appreciate it. Thank
Hope
you.
to be back soon.
Thanks for teaching us.
All right. Bye-bye.
All right. Take care, guys.
Hey man, do you want more energy, more focus, and to just feel alive again? My name's Dustin Wolff, president of Novus. And if you've ever been told that your testosterone is within range and you're experiencing these symptoms, it probably isn't. Wouldn't you want someone to help you, a certified hormone specialist? Well, we can do that. If you go to novomail.com, fill out the information, someone is going to contact you who's going to help, a certified hormone specialist who can come up with an amazing plan to get rid of these symptoms, right? You're going to have more energy. Your libido is going to go through the roof, right? Your focus is going to come back. You're going to sleep. All these amazing things that you experienced when you were younger are going to come back. So go to novomail.com, fill out the form, and someone will contact you within just a few minutes. See you soon.